Hi, this segment is going to be looking at the four muscles of the anterior abdominal wall that you should already be familiar with. On the right hand side here we can see the external oblique muscle, and on the left hand side it's been removed so that we can see the rectus abdominis and the internal oblique muscle. The fourth muscle is the transversus abdominis that lies deep to the internal oblique. I'm going to be asking you to state the attachments of these muscles, and on this model you can see some of those attachment sites. Others you can't see, but you can probably work them out. I'm also going to ask you to state what the actions would be for these muscles and their likely innervation.
You've now seen these muscles on the video, and what we'd like you to do is to list the attachments and the innervation of those muscles. So we've split that up to rectus abdominis on its own up here, and the flat muscles being external and internal oblique, and the transversus abdominis. So if you can attempt all of those questions and complete the blanks, and we'll ask you to pause the video while you complete that task. You'll remember that most muscles of the vertebral column have their origin inferiorly, and that's true of rectus abdominis. Its origins on the anterior pelvis, the pubic tubercle, and its insertions on the anterior rib cage, the costal cartilages and lower sternum. For the flat muscles, they have a common insertion, the linear alba, which is anteriorly on the abdominal wall. So that means the other attachment is the origin. This means for external oblique, its origin being the lower ribs is actually superior to the insertion, so it's an exception to the rule. Internal oblique originates from the iliac crest, and transversus abdominis largely from the thoracolumbar fascia. External oblique has an additional insertion on the iliac crest and the inguinal ligament, and internal oblique has an additional insertion on the lower ribs. And all of these muscles are innervated by the lower thoracic ventral rami. If we look at this diagram, it shows us the layers of the thoracolumbar fascia that we've talked about previously, particularly the lateral raphe that is then an attachment for the muscles of the abdominal wall, and particularly important for transversus abdominis. And we can see the other two flat muscles, the internal and external oblique here, and all of those muscles then make their way around anteriorly to insert on that linear alba, so that's that common insertion. And that insertion is formed when the aponeuroses, that is the flat tendons of these muscles, surround the rectus abdominis inside what's called the rectus sheath. The other thing that we can see on this diagram is the innervation pattern. So a spinal nerve will come out of the vertebral canal, and its anterior ramus will come around between these muscle layers to innervate all of those muscles of the anterior abdominal wall. We can see the same sort of thing on this plastinated section, where we've got the lateral raphe of the thoracolumbar fascia on either side. We can see the three muscles of the abdominal wall, the external, internal oblique, and the transversus abdominis, and these are eventually all coming around here anteriorly to meet at the linear alba, and that where those aponeuroses are meeting anteriorly, they're forming this rectus sheath that surrounds the rectus abdominis. So these are those unusual fascial attachments of these muscles of the abdominal wall. The final fascial attachment is the inguinal ligament, and we can see that on this anterior view. The external oblique, because it's coming down inferiorly from the rib cage, some of the fibres insert on the iliac crest, as we've talked about, but on the anterior aspect of the pelvis, the inguinal ligament separates away from the bone here to actually allow nerves and vessels to reach the lower limb. So the muscle inserts into the inguinal ligament, so again an unusual fascial attachment. Also, somewhat unusually, we might expect these muscles to be innervated by the lumbar ventral rami because they're largely down in the lumbar region, but we can see that on this diagram the ventral rami of the thoracic region, that is the intercostal nerves, follow the line of the ribs down, and therefore those ventral rami from T6 to T12 are largely the innervation of all of the abdominal muscles. The next thing we want you to do is to think about the actions of these muscles, and you should be pretty used to this by now. We want bilateral and unilateral actions for each of these muscles. We've completed one for you, the transversus abdominis, because it's purely horizontal. It runs from effectively a transverse process via the thoracolumbar fascia right around horizontally around the abdominal wall via the linear ulba and back to the transverse process on the other side. So it's not actually crossing any joints as such, and that means when that muscle contracts it squeezes the abdomen to increase intra-abdominal pressure, but it doesn't actually produce any actions. So what we'd like you to do is to complete the blanks in this table and to also tell us which region or regions of the vertebral column these muscles will act on. You can post your answers to this task on the LMS and you'll get responses to those questions on the LMS. Another muscle situated more posteriorly in the abdominal wall is the psoas. We can see the muscle here and its relationship to the lumbar spine and its other attachment disappearing here down into the lower limb. We'd like you to complete the blanks on this slide to describe the attachments and the joints crossed by this muscle, its position and therefore its actions with different types of contractions, and finally its innervation. And you can post your answers to these questions on the LMS system.